Thank you again for this interesting subject. As you said, in the informal sector. An informal sector is a very different, and you have different exposures and different problems coming from this sector. Let's see a bit to figure out what is this sector in the US. This sector is a sector that is, even in informal, it's rather populated. As you can see here, you have 600,000 people working on hairdressing and as in the barber shops, and almost 200,000 people working as nail technicians or manicurists. So it's a kind of important sector from the point of view of the number of people involved, and not just this. As a matter of fact, usually these workers are organized in several kind of organization and in enterprises like beauty salons. You can see here in the US the distribution of this workforce of hairdressers and barbers that are concentrated especially in California, Texas, and Florida. And what about beauty saloon? As I said, it's a kind of enterprise, usually that see a lot of them working in. But as you can see here, barbers and also manicurists and pedicurists, they usually are working alone, working in their own shops, and they're not sharing their experience with the others, while hairdressers are usually working together as employees, usually in large enterprises, at least larger than barber shops, of course. So from this, you can immediately perceive that there is a kind of difference between these figures. And of course, there is a difference in what they could experience from the health point of view. This is a rather recent news that appeared on New York Post a few months ago, where they said that, yes, of course, hairdressers are one of the most, and for them, maybe the most danger occupation for having asthma, in this case, work-related asthma. And that's something strange. We couldn't expect, because it's rather interesting that also the public opinion is interested in this kind of sector as a source of health problems. What kind of health problems have hairdressers? Usually they could have asthma and rhinitis, really very more seldom, hypersensitive pneumonitis, and other diseases like vocal cord dysfunction. Something apart is the neoplastic disorder, lung cancer and mesothelioma. We'll have some speech on it during this lecture. And what about the exposures? The exposures are quite peculiar, because they are on each task of an hairdresser. Any task of hairdressers can be at risk of having an exposure to a substance that could cause asthma or rhinitis. Even the simple washing hair could be some way a treat for a dresser. Could be a treat because sometimes in shampoo we can have some kind of chemicals like this one, like sericin, is a natural products that come from silkworms, and it's used since at least 100 years. And it's quite interesting that it was maybe the first product that gave an occupational asthma in a hairdresser, at least from the publication point of view. And of course, we have in this task of hair washing, the exposure, the possible exposure to natural rubber latex, so to latex in some way, in the shops where the latex had not been replaced by other kind of materials. But the task that maybe is more dangerous for a hairdresser is the bleaching process, the bleaching of the hairs, because the bleaching, during the bleaching, hairdresser used persulfates, and persulfates are the main risk factors for occupational asthma and rhinitis in hairdresser. We will have a small focus on persulfates, because persulfates are widely known as asthmogens, is low molecular weight asthmogens, and they can give a kind of reaction in the airways, and of course also on the nose, in the nose, by an immunological mechanism. This mechanism is often delayed, non-IgE mediated mechanism, while some kind of observation could also imply, for some specific case of occupational asthma due to persulfate, a mechanism in IgE mechanism, because in some cases it would seem that also the skin prick test was positive to persulfates, not just the patch test or the specific inhalation challenge. In some case, also the persulfates could act also as irritant, giving an irritant occupational asthma. And it's something interesting because you have a single compound, a single substance that can give several kind of damage to the airway system. So it's a kind of paradigm of what the chemical used for this kind of services could cause in our workers. And another task that can be dangerous is the process of coloring the hair. The dyes could contain amines, and the amines can give you occupational rhinitis and occupational asthma. Those amines, the most known is paraphenyldiamine and monoethanolamine, can cause, as a low molecular weight agents, occupational asthma. Another type of products quite known is also henna, is a natural product that is involving occupational asthma with an IgE mostly mechanism. And of course, also in this task, the natural rubber latex can play a role. But even other more simple tasks like curling hair could cause occupational asthma. As a matter of fact, permanent wave solution could contain some irritants like ammonia. Ammonia is one of the volatile compounds most present in beauty salon and in hairdresser shops. Finally, also, styling hair styling can cause occupational asthma, always through sericin. Of course, there can be in some of the treatments, some of the sprays used by a dresser in styling, in hair styling. And of course, also polyvinylpyrrolidone, which is one of the most known components of hairsprays, and it's able to cause occupational asthma. So you can see that there are many substances, many chemicals that can give occupational asthma and occupational rhinitis in hairdresser during the usual tasks they are doing in their shops. But besides, we have to say that usually hairdressers are also exposed to quite large amounts of volatile organic compounds, and among them, formaldehyde was found one of the most present, even in a quite dangerous concentration. So it's not really, say, a simple and clean job at all. But we have also to, in some way, reduce the importance of one myth that we have talking about hairdresser and asthma or rhinitis. In fact, the dandruff that usually is placed as important risk factors for hairdresser, as a matter of fact, it's not that important. We have just really few publications on asthma caused by dandruff. In this case, it's a dandruff of wife. Actually, it's quite peculiar here. But yes, hairdresser can be sensitized to dandruff, human dandruff, of course. But this sensitization have no clinical outcomes. Let's say those were found having occupational asthma usually have no sensitization to dandruff, which is more common in those who are not having occupational asthma or rhinitis. So this myth of dandruff as a risk factors have to be in some way reduced in the importance. We talk also a lot about rhinitis. Rhinitis and asthma are often together in hairdresser and hairstylists. They recognize the same risk factors, more or less. Sometimes, but not always, it's before asthma. Sometimes it's contemporary. They are contemporary, but it's rather interesting to see that rhinitis is often coupled with asthma. As you can see here, the nasal symptoms of a hairdresser that have problems at work, even if they are not atopic, have the same kind of wave of an atopic person. So hairdressers very often complain of nasal symptoms, both from irritant and from immune mechanism source. Going to other clinical manifestation of related to the exposure to chemicals at work, or not just chemicals, we have to cite, even if it's a rather old evidence, the case report of hypersensitive pneumonitis in an hairdresser. In this case, which is, I told you, quite old, it was a Trichosporum cutaneum, the responsible of HP symptoms. And this was elucidated also with a specific inhalation challenge with other compounds, and with the discovery of precipitants to the Trichosporum cutaneum in this worker. So even if it's a quite old material and quite old reference, it's always to keep in mind that the hairdresser can be in some way sensitized, in this case, through another type of mechanism, of course, and giving a kind of other disease, which is hypersensitive pneumonitis. Another respiratory disease or symptoms are vocal cord dysfunction. Vocal cord dysfunction, as you know, is an important disease, quite frequent, which is in differential diagnosis with asthma, and is always quite difficult to define one and the other. Is not that easy sometimes. And one case of vocal cord dysfunction had been found in France some year ago, after also specific inhalation challenge in a chamber. And they found, with the help of an ENT specialist, this kind of problem, which is not surprising, because we expect some kind of vocal problem. In fact, hairdresser reported a lot voice problems, and these voice problems are related mainly to phonotraumatic behaviors, so shouting, shouting too much, but also in those who have a long working time. And for this reason, the authors of this paper suggest that maybe also the chemicals, especially those who are irritating, such as the volatile organic compounds, could cause also this kind of problems, or could contribute to cause this kind of problem, of course. Finally, we have to talk a bit about cancer. Mesothelioma has been compensated in some countries in hairdresser. For example, in Italy, we have something like 20 cases, I think, of mesothelioma compensated by our local insurance for workers in the hairdresser shops. And from where is coming asbestos in a barber shop or in a beauty salon? What is the source? The source was, in almost all cases, the presence of asbestos in a dryer. The older dryer contains a lot of asbestos, and sometimes this asbestos is damaged, and these head dryer usually are not well kept in some way. And the use of head dryer is strenuous use by hairdresser. You've been also in a beauty salon, and you see all the time hairdresser with the head dryer in the hands. So the exposure can be possible, and the exposure to asbestos in this kind of sector, not of course actually, but at least in the past, when the dryer had something in asbestos inside, and as you can see, is not really well protected, could cause an exposure to asbestos that could explain mesothelioma. About lung cancer, the situation is quite different because we have no good quality study in the last 10 years, so no update here. We have an old meta-analysis, which is a bit controversial because you can see a kind of risk here, but this risk is not for those who have been a hairdresser for more than 8 years. So it's something strange. Of course, we are talking about small numbers, and even in older, we couldn't find a clear risk of lung cancer in hairdresser. However, we are lacking studies, good quality studies on this matter, and I think it could be important since hairdressers were exposed, first of all, to passive smoking for a long period, but also other chemicals. It can be very important to do some kind of high quality study to explain if there is really a risk or not. But for lung cancer, at least at the present, the evidence are a bit controversial. We have been talking about hairdresser, hairstylist, but we have also to talk about nail technicians, because this profession is a profession that is becoming more and more popular in the US as in Europe. So more people are exposed to chemicals. The main chemicals used in nail shops are for sure acrylates, and acrylates, you know, are low molecular weight agents able to induce asthma. So there are rather a number of studies in some way relating asthma to the exposure to acrylates. All the acrylates you can used in this kind of sector. Acrylates are used to reconstruct nails and do artificial nails. But in this kind of jobs can be also an exposure to formaldehyde and of course to latex coming from gloves, of course. The process of manicuring, so not the artificial nails production, let's say, can give anyway some kind of risk to manicurists, especially those who are involved in for many hours, long period, and there is some kind of risk, even if not easy to analyze and do a kind of risk analysis on human nail dust in this case. The principal problems relate to the profession of nail technician are asthma and rhinitis. They have mechanisms which are similar to the hairdresser, even if the compounds is different, but it's always a low molecular weight compounds as the other we have seen for hairdresser. And we have a number of articles explaining this relation. And what I would like to point out is the association between asthma and skin symptoms or skin diseases. There is always this kind of relationship between, especially nail technicians, between skin symptoms and asthma, and usually it's something that is coming before. I explain. It's starting with skin symptoms, suggesting that the sensitization is through the skin, let's say, and then it come up to respiratory symptoms. And this is something that we can observe also in hairdresser exposed to persulfate or amines. So it's something that is starting with a sensitization by the hands or by the skin in a broad sense, and then it come up to a respiratory, to the respiratory tract. How to study nail technicians and hairdresser to assess if they can have a work-related disease. Of course, as you know, an accurate anamnesis, an accurate taking a clinical history is important, is fundamental. Especially the job history is important to correlate the time when the person can be sensitized and the occurrence of the disease. Clinical examination is important to see if there is other problems more than the one that the patient is reporting. As I said, if the patient is reporting a skin disease, it's always very wise to check if there is also some kind of respiratory problems, because those are always in some way intercorrelated. And then, of course, there is a role of pulmonary function tests, including non-specific bronchial hyperresponsiveness, because, as I always said, there is no occupational disease if you have no disease first. So it's very important to have a clear picture of the disease first, and then go to the etiology of the disease. And then we can do some kind of more specific test. These more specific tests are, for instance, prick test. Prick test with the screening series that they can vary between different countries of different states, but the screening is important to see if there is some other sensitization and atopic status that can influence then also the other sensitization, latex sensitization, and also it's possible to perform skin prick test with persulfate. This is something quite peculiar because there is no agreement in doing persulfate. We have no standardized skin prick testing for persulfate. It's usually done in-house by the single researcher or the single clinic kind of specific skin prick test for persulfate. And of course, skin prick tests are not always positive in case of occupational asthma or rhinitis due to persulfate. I can say also that it's the minority of cases that have a skin prick test positive for persulfate, suggesting that the immediate, the IgE mechanism is usually not the most frequent in the persulfate associated asthma or rhinitis. And then, of course, we can also do other skin tests, the patch test, which are in this case the maybe most important, because all the chemicals that have been reported before, they could have with a delayed sensitization and a delayed symptoms. So it's often positive as patch test for the single chemicals. You can apply with a screening series that are different by different countries, of course, and sometimes they are already including, for instance, amines. And then you have a specific series for hairdresser or nail technicians, including other kind of acrylates, or as in this case, ammonium persulfate, ammonium thioglycolate, glycerate ammonium glycolate, and toluendiamine sulfate. This is the list that is in use at this point in Italy for hairdresser, but it could change by countries. There is some kind of change depending on the kind of substances used in that countries, of course. But clinical examination, accurate history taking, skin test can be not sufficient to arrive to a diagnosis. So it's very important to apply for the gold standard for this kind of problem, which is the specific inhalation challenge. The specific inhalation challenge is the gold standard for diagnosing occupational asthma in a hairdresser and nail technicians. And we have several kind of important point. One of these is that chemicals involved in asthma and rhinitis in hairdresser are also chemicals that are more frequently related to occupational asthma in a broad sense. Is the second, for frequency, is the second low molecular weight agent that, at least in Europe, this is a rather large study done in Europe a few years ago on a specific inhalation challenge, and the persulfate salts were one of the most important in terms of frequency agent used in a specific inhalation challenge. And what persulfates could give, as you can see rather clearly from this scheme involving, in this case, 8 patients with occupational asthma due to persulfate, mostly they have a delayed response that appear, as you can see, after 6, 10, 6, 7 hours after the exposure. Then, of course, you have also some of them showing a clear biphasic dual response, but there is almost always some kind of a delayed response. In this case, the one that you can see on your right up, there is seems there is just an immediate response. I would really ask to the friends working in Barcelona and producing this paper some year ago, what kind of response they had to skin prick testing to persulfate in this patient, because I would guess that this patient was positive in skin prick test, given this immediate response to the specific inhalation challenge. Similar situation we have for amines, for hard dyes containing amines that are giving more not so often delayed response. But even in this case, we have some patient having a delayed response or a dual response. So those low molecular weight agents are usually giving a kind of delayed or dual response more often. This is not the case of male technicians with a sensitization to methacrylate, which show in this case an immediate response and a dual response in this case. So it will change, and doing a specific inhalation challenge could give you also some important points on the mechanism of this occupational asthma in a hairdresser and in nail technicians. So I will suggest to do specific inhalation challenge when the history is not really or completely clear, to have really the diagnosis done in the best way. But we cannot talk about hairdresser and nail technicians without just giving some tips on skin symptoms. We already seen that skin symptoms are associated often to occupational asthma or occupational rhinitis. And usually they come before occupational asthma and rhinitis, suggesting, as I told you, kind of sensitization that starts from the skin. The specific disease usually found in hairdresser and nail technicians are contact dermatitis and contact urticaria. Contact dermatitis is very frequent in hairdresser in particular. Contact dermatitis are both irritative contact dermatitis or allergic contact dermatitis, but it's a problem, this hand eczema, very frequent in hairdresser, especially, with a lifetime prevalence, as you can see, that is more than 38% during the life, and an incidence of 51.8 cases on 1,000 person year. So something quite frequent. Among them, some of them will develop also occupational asthma and occupational rhinitis. Therefore, this group of patients with hand eczema in a beauty salon is a group of people, group of workers that have to be put on a specific surveillance, my point of view, and also contact urticaria. But why talking about contact dermatitis or contact urticaria? Because these are problems that can have an important effect. You see in the prevalence is very high, important effects on not just on health problems, but also on socioeconomic problems. As you can see here, those who are more symptomatic, who has a eczema almost all the time, they will leave this sector, the beauty salons or the barber shops or the nail technician shop, very quickly, as you can see. You can see the line, the orange line, and half of them will leave after few years the first symptoms. So it's really very important to keep in mind that this frequent phenomenon of contact dermatitis or contact urticaria will impact the occupation of our nail technicians and hairdressers. And this will introduce another important concept, which is prevention of this, or at least management of this problem. This problem can be managed as usual with the usual hierarchy of intervention. The first one is the substitution of chemicals that are dangerous with chemical with the less dangerous or at least no dangerous at all. It was like this for latex gloves that for economical problems are in some way in some countries coming up again, even if they almost disappeared in the last 20 years. And the substitution following what is suggested by our Canadian colleagues of Ontario can be substituted. In Canada, methyl methacrylate is banned. So they are using ethyl methacrylate, which is showing less problems than methyl methacrylate. The acrylic nails used by put by nail technicians can be replaced by plastic tips or linen strips more than the usual acrylic nails. And of course, instead of using spray products that can be dangerous for the inhalation, you can use pump dispensers where the dispersion is lower. As well, in the last 40 years, a lot of chemicals have been used to straighten the hair. If possible, if the hair of your client or your customer will allow that, could be better to use heat straightening than chemical straightening. If the substitution is not possible, we can do some kind of measure that could reduce the spreading of these chemicals. One of these can be technical measure. One of the most important is to prepare those chemicals in a room well ventilated. So it can be very important to have a room where these chemicals are prepared, a room which is checked for efficacy of ventilation, and you have this kind of suggestion of 100 square meters for employee, which is quite much, But it's important because one of the problems is the mixing of the chemicals in small places, in small rooms, without any kind of ventilation. And it will increase, of course, the exposure and the probability of a sensitization to these chemicals. So this technical measure to reduce the exposure they are very important. one other important thing is to responsibilize the worker that have to clean immediately spills if they happen, and of course clean all around, because anything that could remain there can be something that another worker could touch and can be in some way sensitized to. There are also organizational measures like organizing the work, especially in beauty salon where the workers are more, distributing the so-called worst work tasks among all the employees. And finally, of course, we can use personal protective equipment, especially gloves, which will avoid possible sensitization through the skin. That we have seen it's very important. A room there is also for other forms of prevention, the secondary and tertiary preventions. And one important point is, of course, workers and employers training and education on this matter. As Professor De La Hoz said before, this is often an informal sector where employers or self-employers or workers are not aware of the risk, and they are really heavily exposed to these chemicals. So it's very important to have always a program of education for these workers and employers. From Europe, we can say that in some groups is very important health surveillance, so focused health surveillance program, for instance, in those who have already skin symptoms or respiratory symptoms not resembling a disease yet, but in some way worrying for the worker, have to be in some way put on health surveillance programs specific that's designed for prevent this kind of disease, or at least make an early diagnosis that can be that can make the worker safe to avoid other more heavy disease like occupational asthma. And then as a tertiary prevention, if we have already a worker with this kind of disease, we have to provide, and it's fair of course, but it's very important, the best medical care in the diagnosis the disease, and so in have a frame where the disease is put in, and of course to provide the best treatment. In this sector, we have just few experience with biological treatment for severe occupational asthma. One of them was recently published on the use of tezepelumab on a refractory asthma that firstly was diagnosed as eosinophilic asthma, but was not responding to anti-interleukin-5 agents, and had a kind of a very good response to tezepelumab. And this is something that is actually suggesting that the mechanism is not just eosinophilic in this case, but maybe the work, in this case the hairdresser work, can have a role in disrupting the epithelial barrier in the airways due to irritating agents or sensitizer like light molecular weight agents. So to conclude, even in 2024, hairdressers and nail technicians are still at risk of work-related and skin diseases like occupational asthma, occupational rhinitis, and contact dermatitis, because they are exposed to many chemicals, especially low molecular weight agents, which are the main risk factors of these kind of diseases. There are still many research needs actually. The role of skin prick testing in the diagnosis, the best managing options. The problem, as I told you about the lung cancer studies, which are really lacking in the last 10 years. And given the peculiarity of this sector, prevention is possible, of course, it's important, but not always easy to perform, actually. Thank you very much for your attention. And of course, I'm open to any kind of question. Thank you.